Joining us now on the Newstrack live and exclusive is the Principal Scientific Advisor to the Government of India, Professor K. Vijayraghavan. Professor Vijayraghavan, welcome to India today. It's been a long time that we've been trying to set up this conversation. I'm glad that you could finally give us time. I want to start by asking you about the government's reading of the current COVID situation in our country. There was a time when the number of COVID cases was 4 lakh plus. It's now come down to around 40,000 a day. There is good news and bad. We're seeing some resistance in the falling graph of the R factor, the reproduction factor, but net cases are coming down. Within government, what's your reading of the current coronavirus state of play?
Thank you very much for having me here. As we've heard from both the Health Secretary and the Home Secretary recently, and from others, the falling of the number of cases is, of course, very good. But at the same time, they're very clearly warned that we are seeing the second wave still going on. And therefore, COVID-appropriate behavior is very, very important in every aspect. You mentioned 40,000 cases a day. That needs to come down a lot more. And that can come down only if we follow appropriate behavior, have masks, ventilations, and distancing. So there is a very strong message of caution which has come out from the government.
Some states like Kerala are contributing a bulk of the COVID cases, almost 30% of the current COVID cases coming from Kerala, which is where coronavirus started out in our country, as it was. So while in other states like Delhi, the graph has come down, in Kerala, it's still holding firm, and also now extending to the northeast, where the number of cases seems to be increasing rapidly. So on Kerala, why has Kerala not been able to get the better of the coronavirus? Is it also because they're testing more? And how concerned are you at this moment about what's happening in the northeast, Professor?
So, it's very, very important. And again, the Health Ministry has sent representatives to all these states to investigate the reasons for upticks. And fundamentally, you have upticks when the virus has opportunity to infect and transmit. And therefore, this is something which needs to be investigated about why you're seeing this more. So there's more susceptible populations in these states. There is change in behavior which allows the virus to transmit. And maybe the situation there requires special attention in all these states to ensure that there's more COVID-appropriate behavior and management of cases until vaccination is substantially more complete.
I want to